the faculty, our esteemed faculty, Dr. L. Mahadevan. Indeed, an honor for me. Miracles happen very rarely, and Dr. L. Mahadevan is one of those miracles that has happened to Ayurveda, and I'm sure you all agree with me. Dr. L. Mahadevan completed BMS from Chennai Venkatramana Ayurvedic College in 1993 and completed post-graduation in Kaya Chikitsa from Government Ayurveda College, Trivandrum in 1997. He started his clinical practice under his grandfather, Vaidyashri Y. Mahadeva Iyer, who was a very successful Shamana practitioner in a village called Derisana Kop. I hope I got the name right, Mahadevan sir, in Kanyakumari district, Tamil Nadu. Dr. Mahadevan is taking care of this hospital and is also a teaching faculty at Pankaj Kasturi Ayurveda College presently. Dr. Mahadevan has a wide range of clinical practice, and he is managing an Ayurveda Gurukulam where he is presently having 19 students with him, for which he is providing free food and accommodation apart from the education. Throughout his life, Dr. Mahadevan has not charged any fee for his classes. His classes in clinical medicines are unique in nature and most in demand and wanted by the student community. He does keep to limit his seminars to 5 a year and would like to spends most of his time in treating complicated clinical cases as in patients. His new project is trying new plants and Siddha medicines along with Ayurvedic medicines in the cancer management. As we all know, Dr. Mahadevan has published 72 books, of which 49 are in English, 43 are in Tamil, and 29 are in English. Presently, Mahadevan sir is working on a monumental manual called Clinical Science in Ayurveda, which we can expect to be released very soon. We are all familiar with the audiovisual DVDs released by Dr. Mahadevan for the practitioners and students. His work on clinical medicine series, Vasti for Beginners, Panchakarma Question and Answers, are indeed very popular among the students and the practitioners. He indeed was initiated into the clinical wisdom by Dr. Vaidyanathan and his PG guide, M.R. Vasudevan Namburi sir, and he was inspired by many others. On behalf of Government of Tamil Nadu, he has written History of Ayurveda and Pradartha Vijnanam in Tamil Nadu in Tamil language for the benefit of first-year students of Government Ayurveda colleges. He has trained personally more than 1,000 students and have influenced many more in India and more than 16 other countries. As presently, he is the teaching faculty associate professor at Pankaj Kasturi Ayurveda College, Tirunelveli. He is authorized medical officer for ISRO, Mahendragiri, and he was a member of the state planning board in the 12th five-year plan. So, and his awards and recognitions go as he has received a Best Scientific Writing Award from Rashtriya Ayurveda Vidyapeeth, Government of India, Acharya Award from CCIM, Government of India, Best Writer Award from Government of Tamil Nadu, Best Doctor Award 2012 from the Tamil Nadu MGR Medical University, Chennai, Arshakula Shrestha from Pujya Shri Swami Dayananda Saraswati, Arsha Vidya Gurukulam, Anakatte, Coimbatore, Vidyadhiri Maharshi Award from SKM. Indeed, he was the best outgoing student from the University of Madras when he passed out his BAMS. Friends, I have just touched a drop of the ocean of the knowledge and the experience and the personality of Dr. L. Mahadevan. I'm sure you would like to know more about him. You are always welcome to log on to his website, www.sharadaayurveda.com. I repeat, www.sharadaayurveda.com. So this is a brief sketch of the miracle of Ayurveda, Dr. L. Mahadevan. So on behalf of AMI, we welcome you, sir, to lead us through the journey of Ayurvedic management of hepatobiliary disorders. Welcome once again and namaskaram. Thank you all.
Oh, okay, thank you, Dr. Valsala. And that was a wonderful way to welcome Mahadevan, sir. So myself, Dr. Vijaynath, working as Assistant Professor in Government Ayurveda College, Tripundra. I'll be moderating the session along with Dr. Arjun. So moving to a few introductory remarks. As you all know, liver is the heaviest gland in the human body. It has a well-defined Ayurveda equivalent, Yatra. The Brihatrayis did not allot a separate chapter for the Yagrit Vikaras, but Lagutrayis allotted a separate chapter for the Yagrit Vikaras. Moreover, the prevalence of fatty liver, that is non-alcoholic steatohepatitis, is found to be 25% in the Indian adult population. It does not have a defined treatment protocol in modern medicine, but can be effectively managed through Ayurveda. The prevalence of liver pathologies globally is found huge. Today, we have with us a stalwart of Ayurveda, Dr. L. Mahadevan. He is an acclaimed physician and has managed a number of hepatobiliary cases. With due respect, I invite Mahadevan sir to commence the session. Please, sir.
Namaste. Thank you, Amma, for a wonderful introduction. Slides. Single. Case study. Namaste, good evening, and thanks a lot for the wonderful introduction. I am talking in this organization after a long period. I am very much thankful to you, sir. It is an honor to be with you all educated, learned, experienced clinicians, practitioners, and teachers. I will enter into the subject with a case study. First, I will tell the case study, then I will go into the subject matter. A patient, 60-year-old male, came to me from Chennai. He had swelling of feet and ankles, generalized edema, abdominal swelling, circumference was 49 inches, very poor appetite, dry skin, fatigue, dyspnea, enlarged breast, scrotal swelling since 2 months. There is no history of diabetes, no hypertension mild, no acid peptic disorders, bronchial asthma, allergies, no habits, mild anemia, no vomiting, occasional headache, no seizures, no renal stones, no ischemia. Jaundice he was not knowing, no TB, generalized itching was there, no thyroid, no hemorrhoids, no vertigo, cataract surgery, no smoking, no alcohol. Obese person, other parameters were normal. Urine output was very less, bowel movements regular, salt was restricted. So here, his bilirubin was slightly high, direct bilirubin is high, SGOT is high, around 84. SGPT is high but less than SGOT. Alkaline phosphatase is very high, then AG ratio. In this picture we can see increased bilirubin and hepatocellular damage by elevation of SGOT and PT. Usually in fatty liver, non-alcoholic fatty liver disease, PT is more than OT. Here OT is greater than PT, which is usually seen in alcoholic liver disease and in NASH. Alkaline phosphatase is very high, PT 63, alkaline phosphatase was high. Whether the person is having simple fatty liver or NAFLD or it has changed into NASH, NASH fibrosis, cirrhosis, we do not know. Cirrhosis, when established, decompensated, we will be knowing the classical pictures. Icterus, palmar erythema, spider nevi, ascites, portal hypertension, splenomegaly, thrombocytopenia. We will be seeing that. But in compensator state, we do not see that. Gamma GT was 230. So ultrasound showed chronic parenchymal disease, no mild splenomegaly with moderate ascites with portal hypertension. There is pelvic lymphadenopathy needed clinical correlation, and mild pleural effusion was there. So liver shows chronic parenchymal disease, probably early cirrhosis. In child books criteria, Relas Institute is one of the best institute in the country for liver transplant. Mild splenomegaly and ascites was there. So they thought it was a case of pancreatic CA and went to Cancer Institute, Adayar, and investigations were done, which is normal. Now you see the person before the treatment with ascites. Ekrutrogam, chronic parenchymal liver disease. This has attained Karibudha given by Chakrabani. Karibudha yadi katoradam upagataga. Scary changes in the ekrit due to Kumbhakamala. Cirrhosis is a condition in which liver does not function properly due to long-term damage. Nowadays, alcohol cases have come down, hepatitis C has come down. NASH cirrhosis is going on increasing. Any practitioner may be aware of this condition, this scenario. This damage is characterized by the replacement of normal liver tissue by scar tissue. Normal size of the liver in ultrasound is 16 centimeter. The liver size comes down in cirrhosis. The spleen size increases in cirrhosis. Here, Agnideepanam, Amapadanam, Tiktarasa Prayogam, then Madhurarasa Prayogam, Srodoshodanam, Sofagnam, Mutra Prayogam, Ruksha Virejanam, Yakrit Visesha Rasayana Aushada, incorporating Pandu Chikissa, Uttara Chikissa, Sofa Chikissa, Kamala Chikissa are highly useful. Deepanam and Pachanam are very specific words. Deepanam can be Snigdha. Kridam is Deepanam, which is Snigdha. Pachanam is Amapachanam, Malapachanam. Pittam is Snigdham, Kapham is Snigdham. They are malas, so that is the Pachanam. We can do Pachanam. We can do Pachanam by Tikta Rasa or by Kadu Rasa or a combination of both. For suppose a psoriatic arthropathy comes, we may be giving Amrudottaram Shaddaranam, Tikta Kadu. But in a case of bronchial asthma, we will be giving Indugandam, Vaishwanaram, Talisavatradi, Vyoshadi, Kadu. So Kadupajanam, Tiktapajanam, Tiktakadupajanam are very important. Tiktam is the most suitable dresa for a rogi. Madhuram is the most suitable dresa for a healthy person. The treatment starts with Tikta and ends with Madhura in most of the cases. Even if you take Vadarakta, the last chapter for doshas in the text, the treatment starts with Tikta Rasa, Madhura Rasa, Snigdha Yukta Virejana, Kshiravasti, Rasayana, etc. So Tikta Rasam has to be given in this case first.
because Tiktam is Amapadanam, Raktaprasadanam, Shofagnam, etc. Then Srodo Shodana Chikitsa, Shofagnam and Mutrala Prayogas. Shofagnam is basically Tiktarasa. The Samulam is Shofagnam, Punarnava is Shofagnam. Gokshuram, Shadavari, Bala, Kogilaksham, they are Madhura Rasa. They increase Kapha, Madhura Vibhagam, Shida Viryam, Snigdha Gunam. So they are Mutrala in nature. Then Pittam is Snigdam, Kapham is Snigdam. So we will be giving Ruksha Virejana Aushadas. Ruksha Virejanam is divided into three. Uttama Ruksha Virejanam, Mathyama Ruksha Virejanam, Hina Ruksha Virejanam. Uttamam Nimbatvakadi with Trivrit, Madhyamam Padola Moladi, Padola Kaduroginyadi, Hinam Avipati, Vasa Kuduchiadi, etc. Yakrit Visesha Rasayana Aushadas, many are there. Vardhamana Vipali cannot be given in people with portal hypertension and esophageal varices because it may produce bleeding. It may increase, we have to check the prothrombin time and decide the dosage of Vardhamana Vipali. You have to incorporate Panda Chikitsa, Udara Chikitsa, Sofa Chikitsa, they are interrelated. Because Udara Chikitsa, Udaram is an extended version of portal hypertension.
So in this case, I selected Punarnavadi Kashayam. If you see Vangasena and all, only in Pandukamala, last Punarnavadi is told. Kuduchyadi, they are Tiktarasa, Amapadana, Sofagana, and Udara, Nityameva Virejaye, Haridagi Churnam, which is Rasayanam, Vata Kapagaram, Anulomanam, has been selected. After 2 weeks, the patient came for review. Same complaints were there. Abdominal swelling was increased. There was dyspnea. Weight increased. Appetite improved. Bowels were regular. Urine output did not improve. So I admitted the case and restricted the salt. Lavanam is abhishanti and Ushna Snigdam it is. Pittam is Ushna Snigdam. So Lavanam is restricted. So we have parallelly investigated the case not to miss anything. Hepatitis A, B, C were ruled out. Leptospirosis was ruled out. And sometimes when a rheumatoid case take treatment from Ayurveda, suddenly they develop jaundice. Most of the time it is autoimmune hepatitis. There are 3 tests for checking autoimmune hepatitis. We do it in the day 1 admission itself if you are planning for Balladaka Mandal in that case. Liver kidney microsomal antibody, anti-smooth muscle antibody, ANA, anti-mitochondrial antibody, which is very specific for primary biliary cirrhosis. So these tests were also negative. Even though there was no neurological cerebellar signs, we ruled out Wilson's disease also by checking blood ceruloplasmin and urine 24 hours copper. That was also negative. So we were ruling out all these things. Any cirrhosis, you have to check alpha fetoprotein. Alpha fetoprotein, there was not much elevation. Contrast CT was done to rule out hepatoma. Then Punarnavadi was continued. Manduradi Kudinir, a Siddha medicine, we also have the same medicines, were given. Manduram, Amrapatram, Bringarajam, Bhumi Amalagi, Patola, Mishreyam, Vilva. Then Bringaraja Prayogam was started. Bringaraja, Neeli, Kuppaimeni, Harida Manjari, Habusham, Mandugabarani. This was given along with the conventional medicine. Tamalaki and Bringarajam are not very well elaborated in Kamala Chikitsa in Brigatrayis. Tamalaki was introduced in Kasaswasa Prakarana. Nowadays, even in the COVID, some of the people, as Tamalaki is having, Kridanali is having antiviral property, they made an approach to study this material. Even I have got few papers from them, and I have gone through that. That is another style. So appetite improved, bowel evacuation improved, water intake improved after the sofa is over, urine output improved, BP stabilized, weight little bit reduced. The patient was discharged on advice to continue the internal medicine. Blood investigations revealed vitamin deficiency. He was from vegetarian community, so naturally B12 was very less. Then Vasaguduchadi, Brigatyadi Kashayam were given, and we have a churnam called Kamala Roga Churnam in our hospital. Paribhadram, Kaidaryam, Sharabungam, Dhanyagam, Gokshuram, Vishnukranti, Amalaki, Kogilaksha Hriberam, Kadurogini. Paribhadram, nobody is using. Sharabungam, Kerala, they are using, we use a lot. Vishnukranti, Tridoshagara Dravya, we use. Kadurogini, of course, very commonly used medicine. 3 drugs are unique. Paribhadram, the tender leaves of Paribhadra, Poovaras is the special drug what we give. Patient came for review after 1 month. Edema was reduced, appetite, bowel, water intake, urine output improved, ascites reduced considerably, abdominal circumference became 44 from 51, uric acid elevated, alkaline phosphatase elevated, albumin was low, urine microalbumin was very high, prothrombin time stabilized less than 1.2. Alpha fetoprotein from 60 came down to 6.2. ESR was very high, hemoglobin slightly improved. Vitamin B12 was very less. Amylase was almost normal. Alkaline phosphatase started coming down. Albumin improved from 2 to 3.5. As we were giving Tikta Rasa Prayoga continuously, Pitta Samana has taken place and Vada Vriddhi has taken place. So we started giving Madhura Rasa Yakrit Visesha Aushadas like Drakshadi Rasayanam or Mridvigadi can be given. Here we have given Drakshadi. Draksha Prastham, Kanaprastham, Sharkara, Ardhadulantada. The main ingredient is Amalaki, around 11 prasthas. So, after this study, all the enzymes except alkaline phosphatase came down. Alkaline phosphatase also 70% came down. Ammonia was stable. There was no hepatic encephalopathy in this case. Urea creatinine was normal. That ruled out hepatorenal syndrome. Ferritin is usually high in liver disease, NASH, cirrhosis. Here ferritin is normal. Folate was very less, probably megaloblastic anemia. Now you see the X-ray, no effusion, no significant abnormalities detected. Then ultrasound was done. Ultrasound retroperitoneum appears normal. No retroperitoneal lymphadenopathy. No free fluid in the abdomen. That means there is no ascites. Patient gives history of NASH with ascites, mild coarsening of echo structure, mild splenomegaly. So ascites, he was relieved from ascites. Now you see the photo. You see both the photos. This is before treatment. This is after treatment. He was intended for liver transplant, and now he takes Drakshadi Kashayam, Shadangapaniyam, once in 15 days, Trivruchurnam with milk, Virejanam, Amalaki tablet, and like that he is having Vadapitta Shamana, Madhura Rasa, Ekrit Visesha, Aushadas, things are stable. So hepatoprotective drugs for obstruction, Shagagata Kamala, which we are going to talk, we give Pippali, Sharabunga, Kadugarogini, Kakamachi, and Yarandapatra. The college where I studied in Venkatramana Ayurveda College in Chennai, they give tender Yarandapatram with milk for 3 days. People, it's free of cost. Nearly 100-200 OP in Chennai city used to come for taking this medicine. So Yarandapatram, tender Yarandapatram reduces bilirubin within very short period of time. For fatty liver is a self-created sneha vyapat. What are all the items that are told for sneha adi yoga, like Triphala, Arishta, Gugulu, Shilajat, Shamaha, Gotrava, Pippali? All these things are actually having low glycemic index, and they work on triglycerides, reduces triglycerides, because fat doesn't create fatty liver, it is the triglycerides that create that. Chydarium, Bringaradam, Guruchi, Bonimbam, Haridra, and Takram. Takram is a very effective medicine in fatty liver. Takram with Trikadu is specifically given in Yakrudodara Chikitsa. You would have heard, many audience are new to me, I will tell it again. Dadi is the yoni. From Dadi, Gridam is derived. The antidote for Gridam is Takra. Gridam is Snigdha. Takram is Ruksha. Tilam is the yoni. From Tilam, Thailam is derived. Thailam is Snigdha. Punyakam is the Ruksha. Punyakam is the antidote for Thailam. So, from one yoni, 2 gunas we are deriving. This is M.R. Vasudevan Nambudiri sir taught me. And antiviral property. We give Tikta Rasam, Ruksha Virejanam, then Madhura Rasam, then Snigdha Prayogam, Jimudanasyam intermittently. Jimudanasyam works only in Koshtakata Kamala, not in Shakakata Kamala or in Paratantra Kamala, which I am going to explore later. Antiviral property drugs, in my experience of 22 years, Padolam, Bunimbam, Chandanam, Haridra, Nilini, Sharabungam. Nilini is a very good drug for acute hepatitis B and C also. Alcoholic liver disease, where GGT will be high, Parivadram, Madayantiga, Marudani, Yashtimadu, Punarnava, Gokshura, Kakamachi is very good. For hypoproteinemia, albumin will be less. If you read Patola Muladi Kashayam, Mamsarasam is the Anubana, Jangala Mamsarasam. Why should they say Mamsarasam for Shadratra Prayogaga? Adivirejanam is contraindicated. Mamsarasam gives protein supplement. In hypoalbuminemia, in hypoproteinemia happen in liver cirrhosis. That is why this Anubanam is specifically designed for Padola Muladi. If you are not able to provide this Anubanam in an inpatient setup, better you go for Padola Kadaroginyadi and don't say Padola Muladi is not effective. Sharapunga, Punarnava and Kumari in hypoproteinemia. So from my experience in this case, Gudabipali reduces alpha-fetoprotein. Gudabipali is told in Vaishajaratanavadi, Ekrit Pligadigaram, it contains Sharas and Lavanas. Padola Kadaroginyadi is Ganam, which reduces SCPT and OT in 10 days. Drakshadi Rasayanam, choice in liver cirrhosis for maintenance. Vasa Guduchadi also reduces PT and OT. Bringarajachurnam, very good supplement for NASH. Trayandiadi Kashayam reduces itching in obstructive jaundice. Trayandi is Brahmi, it contains Trivrit, it contains Kadagarogini, it contains Padola Moolam, it contains Masuram. Masuram is a protein, it is called Karamani in Tamil. So Anupa Sagabanam is Gritam. So Trayandyadi Kashayam I have given in hepatocellular cancer, very effective. In the last 22 years, I have seen only 2 amoebic liver abscess, Antarvitradi. In that, I have given Trayandyadi Kashayam and Arogyavardhini Vadi. Drakshadi Kashayam reduces GGT in alcoholic liver disease. Brihatyadi Kashayam, Kaniya Panchamulamcha is told in Kamala. Panchamulasya Datrivai is told in Vadaraktam. Brihatyadi Kashayam is very good in portal hypertension, because in portal hypertension, if there is esophageal varices, you cannot go for Gomutra Harideki, Vardhamana Vipali, etc. You should go for little Saumya Dravyas. Now I have compared all these things before we enter into the topic. Poshta Shakasada Kamala, that is hepatocellular jaundice, hepatoma, viral hepatitis, Wilson's disease. Ruddhavada Kamala is obstructive jaundice. Kumbha Kamala is ascites, portal hypertension, cirrhosis of varied etiology. Halimagam, hepatic encephalopathy. Panaki, hepatic chronic hepatitis. Udaram, ascites with various stages of portal hypertension. Ekritvithradi, hepatic abscess. So other herbs for liver conditions which are used in the place, Duktiga, Amman Pacharisi, Kalashakam, Kasini, Bonimbam, Nitya Kalyani, Aviri, Krishna Jairagam, Narigala. These are all the drugs that are used in our practice in liver diseases. With this case study, now we will enter into the topic. Ekrit and Pliha are produced from Rakta, gives color to Rasa. They are the seat of Sonida Vagasrotas. Liver and spleen are related to blood. Formation of blood starts in the 3rd week of intrauterine life. Between 3rd week to 3rd month of intrauterine life, erythropoiesis occurs in the mesoderm of the yolk sac. This is the only stage in the entire lifespan of the individual when erythropoiesis occurs within the blood vessels, intravascular erythropoiesis. In all other conditions, erythropoiesis occurs extravascularly. Then red bone marrow starts erythropoiesis. This is called myeloid phase. So it is true that there is a relationship between Yakrit, Pliga and Rakta. Raktavaganam Srodasam Yakrit Moolam Pligasya, because the statement by Charaka, Mamsa Sonida Upachaya, occurs in 5th month, appears to be correct. Liver and stomach play their role in the formation of Ranjaka Pitta. Maramatangiradhu. Pliha definitely produces Rakta during intrauterine life. This is again a new thing I have studied from embryology. This is called hepatic phase of erythropoiesis. In emergency, Pliha can produce 150 ml of blood in one cycle of blood circulation. We should teach all these things. We should not tell rectum is produced from yकृत and liver, and then we go to modern counterpart and tell bone marrow is the only place where these things are produced, red bone marrow. Harima is one of among the 12 diseases told in Atharva Veda. Harima means that which is yellow in color. The description of Kamala is found in Brihatrayis. Kamala is not a Mahavyadi. Hridrogam is not a Mahavyadi. Hridrogam is related to Vegadharana. Among the 14 Vegas, 12 Vegadharana talks about Hridroga. Vegas denotes autonomic nervous system. Vega denotes sympathetic and parasympathetic ganglions. You can flex and extend the hand, but you cannot control. If you take the Gray's anatomy and if you take the Vegas, if you start drawing the ganglion from Purisham to Nidra, one by one ganglion of the 14 Vegas synchronize with autonomic nervous system. That is why Vegana Daraye, Udiranam Kadimadam, Udiranam Chanikraha, Sevanam Sagadana, Marinam Adisevanam, all these things are told. Charaga, Vapada, and Susruda have mentioned Kamala along with Pandurogam. Charaga mentioned the division of Kamala in Sutrasthanam in Ashtavadhariyam Adhyaya. Kamala, Panaki, Lagaragam, Alasam, Pandurogam. We have standardized this, but it seems to be an academic subject matter, but that is also important. Kamam, Ladi, Hanti, Idi, Kamala, that which destroy all the desires. If you read Halimakam, you can see that the desires, sexual desire itself is lost because hypogonadism, loss of pubic hair, loss of axillary hair, gynecomastia, or seen in cirrhosis, end stage liver disease. The disease which makes body full of malas is Kamala. It says that disease in which Dadu and Mala become Kulsita Mala, that is called Kamala, accumulation. There is no specific Nidanam for Kamala, Alpitta Vritti Nidanam, and whatever is told for Pandu is applicable here. Aganduji Nidanam, Sharad Rudu and Varsha Rudu are the natural Pitta Prakopa Kala. We can see epidemics of viral hepatitis A commonly found in this season. Now, classification of Kamala, Koshtasrada Kamala. This Koshtasrada Kamala, the Pitta goes Samurchana with Rakta, stays inside the liver and produces jaundice. Hepatitis A, B, C, D, E, Wilson's disease, hepatocellular carcinoma, hemochromatosis, all these things we have to apply the principle of Koshtasrada Kamala. Padolamuladi, Vasa Kuduchiadi, Drakshadi, Trivruta Churnam Virejanam, Shadangavaniyam, this type of approach, which is otherwise called Bhagavitta Kamala, Koshtakata Kamala, Swatantra Kamala. Now the Pitta goes to the Shaka, blocked by Kapha, unable to come to the Koshta. So the Koshta does not receive the Pitta till a Pishtam, China clay colored stools is formed, which is obstruction, which is Alpa Pitta Kamala, told by Chakrabani, which is Paratantra Kamala. At its end stage certain diseases, it can come. So, Shagagata Kamala, we will have to bring Samayotan Prayogana Sugamva Koshtamane. We will be bringing Kadurasa Aushadas there. Kadurasam is Pitta Vardhanam, Kafaharam, Saraguna Vardhanam. That is why Trikadu is told, Mulagam is told, Kulatta Yusham is told, Charam is told, Kukkuda Mamsam is told. All these increases Pitta, reduces Kapha, remove this Roda, Pitta comes to the Koshta, the color of the motion becomes normal. Then we have to do the routine Koshtakada Kamala Chikissa. So there is no description of Kafaja, Vadaja Kamala, Pittaja Kamala, Kafaja Kamala, but practically fatty liver, non-alcoholic steatohepatitis, they comes under Kapha Kamala, where we will be selecting Kadurasam Ekrit Visesha Dravyas like Gudavippali, Sharavanga, etc. Then it becomes hepatitis, esophageal varices, it becomes Pittaja. In Pittaja, we will be selecting Tiktarasa medicines like Shodana. Tiktam is again divided into two. Shodana Diktam, Shamana Diktam. Shodana Diktam, Uttama Shodanam, Madhyama Shodanam, Hina Shodanam. उत्तमशोधनं निम्बत्वगादि, मध्यमशोधनं पडोलगडुरोहिण्यादि, हीनशोधनं वासागुडूच्यादि, समनदिक्तं गुडूच्यादि, निम्बादि, षडङ्गम, etc. After tikkarasam, madurarasam is selected. Kashaya dikta maduram, pittam anyedu kurvade. Kevala pittam, tiktam, jwaram, guduchiyadi. Kafanubandha pittam, kashaya rasam, arakodadi, eczema. Vadanubandha pittam, peptic ulcer, drakshadi. So this is why kashaya dikta maduram, pittam anyedu kurvade. When it becomes vadaja yakrit roga, you see the fatty liver, ordinary fatty liver, many people are having. But when SGPOT increases, nowadays the only standard test is fibroscan or MRI spectroscopy. The MRI spectroscopy is not available, but fibroscan is available everywhere, which gives the elasticity of the liver tissue. Other tissues, other tests like USG cannot pinpointedly find the liver fibrosis. Vadaja, liver fibrosis, cirrhosis, Vadaja Ekrutrogam, we will be managing with Madhura Rasa Ushadas, Drakshadi, Yashtimadu, Karjura Phantom, Mridvigadi, Drakshadi Legium, etc. So these types of, first we are selecting Kadurasa, then Diktarasa, then Madhura Rasa, likewise Kafaja, Pittaja, Vadaja. Avastha Vishesha classifications are there. If you take the Swasa, Mahaswasam, Chinna Swasam, Tamaka Swasam, Pradamaka Swasam, Urdhva Swasam, Chudra Swasam. That is cortical, subcortical, medullary, respiratory, hyperventilation and psychogenic. This is the order in which beautifully it is narrated. Cortical and medullary types of Mahaswasam and Chinna Swasam, no treatment is told. Only for Tamaka Swasam, Vada Kafakaram, Ushnam, Anulomanam, Pramadi, Agni Devanam, Amasegada, Amanasanam, all these things are told. The first two things are not told. Raktabittam, Kamala and Swasam, Avastha Vishesham classification is done. Pandurogam, Pandurohi who takes Pittal Aharas. Pandu also, there are two differences of opinion. Susruta talks about Vyayama Mamalam Lavanaadimatyam Rudam Divasupnam Adivatishnam Nisheva Patusha Raktam Dosha Twacham Panduradam Nayandi. You have got practically Rasapandu and Raktapandu. In Rasapandu, Rasavaga Srodo Dushti, in Charaka Samhita, in Rasavaga Srodo Dushti only Pandu is told. In Raktavriddhi and the Raktakshayam Lakshanas, Pandu is not told. In Rasapandu, all these nutritional anemias come into consideration, where we will be giving Punarnavadi Kashayam with the Pranada, Gomutra Haridagi tablet, Tikta Kadurasam. Then if you read the Charaka Samhita and if you read Ashtanga Hridayam, Pitta Pradane Dosheshu, Dadu Saivilyadi, Odakshayam, Sarakshayam, Pandu. Where Pitta Pradane Doshas, we will be selecting Tiktarasa Ushadas like Vasa Guduchiyadi Kashayam, Trivruta Churnam, etc. So you have Rasapandu and Raktapandu. Here Vagbada is talking about Raktapandu. Pandurogi takes Pittala Aharas, Dushti of Pitta Rakta and Mamsa, and Kamala is produced. So Dosham is Pittam, Dusham is Rasarakta Mamsam, Srodas is Rasavagam Raktavagam Mahasrodas, Srodo Dushti is Sangam Vimargagamanam, Vektastanam Tok Netra Mutram Sakrit, Adhishtanam Yakrit. Liver has got multiple function, metabolism, secretory, excretory, synthesis, albumin synthesis, vitamin K synthesis, storage of vitamin, detoxification. So you have got Koshtaja Kamala, that is called hepatic jaundice. Then you have got Shakaja Kamala, that is post-hepatic jaundice. Then Pandurogi to Atyartam Pittalani Nishevade, hemolytic jaundice. The Pandujanya Kamala, that is pre-hepatic. Paradandra Kamala, that is Pandurogi to Atyartam, pre-hepatic, that is unconjugated. Hepatic can be conjugated or unconjugated. Shakajam is conjugated. So this the direct and indirect, we can talk in terms of conjugated and unconjugated. Alkaline phosphatase, you have to think about liver obstructive pathology. AST and ALP, that is SGOT and SGPT, you should think about liver hepatocellular damage. Albumin, you think about cirrhosis and liver failure. Bilirubin, bilirubin can be seen in various diseases. Liver disease also it is seen, in some other conditions also it is seen. Gamma GGT, gamma GT, gamma glutamic transaminase. In gamma GT, you can see elevation in alcoholism. Lactic dehydrogenase is also checked. It's not routinely checked. Prothrombin time. In some LFT they do prothrombin time. In our district, Nagarjuna, they do it regularly. In other places we have to ask for separately. Jaundice is the yellow discoloration of the skin and sclera and eye because of high levels of bilirubin. In Gilbert syndrome, mostly in Pitta Prakrtis, this bilirubin will be slightly increased and it will not cause much problem, which is called unconjugated hyperbilirubinemia. Dubin-Johnson syndrome is a very rare autosomal disorder, which is conjugated hyperbilirubinemia. Gilbert syndrome, everybody would have seen. Reinsurance is enough. Clay-colored stool, itching are commonly seen in obstructive jaundice. You see the jaundice case, icterus. After it crosses 3, that is when we say diabetes, 180 milligram per deciliter is the renal threshold. Likewise, the bilirubin threshold is 3 milligram per deciliter. After 3 only, you will start seeing in skin, sclera and urine. So in Koshtagata Kamala, hepatitis, Wilson's disease, hepatoma, hepatocellular CA, if you get it, you do the Koshtagata Kamala Chikissa. In biliary atresia, biliary obstruction, cholecystitis, cholelithiasis, tumors in duct, you do Shagakata Kamala Chikissa. In hemolytic anemia and hemoglobinopathies, you do Paratantra Kamala Chikissa. Tilapishtam, you already China clay-colored stools we have discussed. Kumbhakamala is cirrhosis. NASH cirrhosis is very common nowadays. Even then our medicines are very effective in this condition. This is a very potential area. Modern medicine say you have to reduce weight, you have to reduce carbohydrate, you have to go for walking. Statin is not contraindicated. They have invented a new drug called saraglitazar that is also very effective. Modern medicine is using fibroscan and in some places MRI spectroscopy, elastography is also used. It is Dirghakala Anubandhitvam. Doshas become Karibhuda, hard and cirrhotic changes. Rough form, that is the meaning. Chakravani uses the word. Kumbha means Koshtam also. According to Chakravani, Kumbham is Koshtam. So we have to write test anti-HIV IgM for hepatitis A, HBsAg for hepatitis B, anti-HBC also you should write, anti-HCV for hepatitis C. These 3 tests are very important. Then leptospirosis IgM has to be ruled out. In hepatitis, loss of appetite, nausea, vomiting, fever are seen. A, B, C, D, E are common. A, vaccine they are found. B, vaccine they are found. C, one of the cause of cirrhosis and cancer. Alcohol abuse can produce cancer. Alcohol cases are coming down. NASH cirrhosis cases are increasing. Paracetamol, if you take more than 4 grams per day, liver toxicity can come. Anti-TB drugs, anti-epileptic drugs, amiodarone, sodium valproate, they can also produce hepatic fibrosis. Anticoagulants, warfarin. Hepatitis can be short-lived or it can become chronic hepatitis. Causes, viral, alcohol, drugs, biliary obstruction. Fulminant. Fulminant means sudden onset. Hepatitis A spread through poor hygiene, eating in hotels. That's why I tell sambar is heated, chutney is not heated. Through chutney, hepatitis and amoebiasis can spread. Nowadays, young children are vaccinated against hepatitis A. Immunoglobulins are also given to people who are exposed to hepatitis A. Pregnant lady with hepatitis B can transmit the virus to the baby. It can transmit through saliva, tear, breast milk, vaginal fluid, and semen. Hepatitis B acute phase, our medicines will be very effective. We can manage it, but in the carrier state, Gudalinga Abhyakta Vyadi. So we have to do a Shodhana, give Rasayana for a long period. Still, many carriers are carriers only. It is not becoming negative in many of the circumstances. Except one or few, most of the time it is resistant only. HBsAg indicates current hepatitis B infection. Anti-HBs indicates immunity to hepatitis B infection, that is vaccinated. Anti-HBc indicates previous or ongoing hepatitis B infection. So you have to interpret this test. Hepatitis C spreads through transmission. It is very dangerous. They become cirrhosis. Any cirrhosis, you have to rule out liver cancer, hepatocellular carcinoma. You have to do contrast CT abdomen pelvis with alpha fetoprotein. Biopsy, there is a great risk of bleeding. So biopsy is seldom done, very rarely done by a specialist in the field of hepatology. Acute viral hepatitis, flu-like symptoms will be there. People who want to smoke will dislike smoke. That is the thing. You have to do HBsAg and anti-HCV in suspected cases. Chronic hepatitis can come, NASH. I have seen people with elevated, they say it will take long years to cross the stages of fatty liver, NAFLD, NASH, fibrosis, cirrhosis. One cycle is 8 to 9 years. So we have got a lot of time to intervene. But most of the time, we will be seeing cases with the decompensated stage. In decompensated stage, they come with the icterus, ascites, umbilical hernia, gynecomastia, axillary hair absent, ascites, pedal edema, hypoalbuminemia, thrombocytopenia, anemia. Then our treatment may not be effective and we have to struggle. That is why we have to pick up all the diabetes, all people with central adiposity, incidental elevation of SGOT and PT, incidental checking of OT greater than PT. All these cases we should screen very carefully to find the cases. So Uttama Virejanam, Padola Muladi, Madhyama Virejanam, Padola Gaduroginyadi, Hina Virejanam, Vasa Guduchiadi, Devadali Nasyam. Devadali Padanasyam came in 12th century. Before that, in some older textbooks, I have seen Rolambiraja mentioned Devadali Palanasya for Kamala. In Vankasena also, it is there. It is irritant to sensory organs. We have to soak it in milk, squeeze it, and apply 8 drops of Nasyam. In Koshtasrada Kamala, in Ruddhapada Kamala, it is not very effective. It is Kadarasa, Tiktarasa, Snehanasana, Tridoshagara property. 8 drops of this rasa can be installed in each nostril. Devadali is otherwise called Jimudam also. It is a Shodhana Nasyam, it is a Rechana Nasyam. It induces excretion of accumulated Malarupa Ranjagapitta via nostrils. Nastaka Prashartanam, that is actually seen in this condition. It is a Shodhana Nasya, thus it explains the role of Nasya at systemic level, why the level of serum bilirubin comes down. Serum bilirubin, alkaline phosphatase, ALT, AST come down after Devadali Nasya in repeated investigations once in 24 hours. Analysis of nasal secretion shows bile salts and bile pigments. So hepatitis, first we will give Padola Muladi, then Nimbattogadi, Vasa Kuduchiadi, then you go for Mridhigadi, Intravarani Churnam or Avipati Churnam Virejanam. Then Padola Muladi Kashayam, already I talked. Nimbattogadi also contains Padolam, Shama, Trivrit, Neeli. So this makes it as a Virejana Dravya. And Rakshadi, Gudavipali, Kaudaja Triphala. Kaudaja Triphala is a wonderful drug. If you get good Shilajat and if you do Bhavanas properly, in Aksha Pramanam it is made. It can be given before food or after food. It can be given with Dadima Sorasam or Madhulanga Sorasam. It is a very good, it is called the Kaudaja Triphala Legium. Some people call it as Vajra Vadagam, Shilajitwadi Vadagam. It is not Shiva Guliga. Shiva Guliga is Mangala Shiva. The word Shiva is told, but Shiva Guliga is entirely different yoga told in Ashtanga Sankara, Vajigatana. That is Shiva Guliga. That is different. And Chandra Prabhavadi, the word Chandra Prabha has got two meanings, Pachakarpuram and Bakuji. So that is why it is called Chandra Prabha. It contains Swarnamakshigam, Logavaspam, Gugulu, Shilajat. It can be Shadushanam. It can be given in Ruddhavada Kamala. Sudarsanavadi contains Bunimbam. It is a thick samana ushata. Bunimbam has got wonderful effect in reducing SGOT and SGPT. It is a, if you see the Shofa Chikissa, next word of Ajajivada, the Shofam, Tridosham, Pravritam, Bunimbam Ahaushadascha. Bunimbam and Shunti is the best medicine for Tridoshaja Shofa. I am giving that in chronic renal failure, creatinine up to 6 and urea up to 70-80. Bhunimba Mahaushada Prayogam told by Vagbada Ashtangaradya Chofa Chikissa is highly practiced. I have made this as a 1 gram tablet and very, very successfully that is used in practice, and it reduces. It reduces, good for liver, good for Trimermium. It is for Trimermia Rogam, it is effective. Fatty liver, fibroscan is very much essential. Very few people with fatty liver end up in NASH, but many nowadays we see lot of NASH cirrhosis coming. Around 20 cases per year, 20 to 25 cases per year I am seeing. So it's a worrisome scenario. So Kodravam, all these low glycemic index food, controlling diabetes, hypertension, cholesterol are very important. Most of the time the mortality is due to acute coronary syndrome. So triglycerides also has to be protected. Kaidaryadi is a very good yogam for fatty liver other than the conventional liver specific medicine. Kaidaryam has got a property of reducing triglycerides and correcting the liver functions. Kaidarya Churnam is also very good. Gudavipili is a wonderful yoga, but it is very, the salts are adulterated, ksharas are difficult to prepare. Like say Shilajit. Shilajit is wonderful drug, Shilajitwadi Vadagam, but Shilajit is questionable. Cirrhosis of the liver, itching, nodules around the eyes, malabsorption, muscular atrophy, palmar erythema, Dufy-train contractures. You see palmar erythema, Dufy-train contracture, spider navy, axillary hair loss, gynecomastia. See, NASH cirrhosis cases are more nowadays. Cirrhosis due to hepatitis C is also more. Then comes alcoholic liver disease. Some people have familial. Many people in the family are affected. That is also seen. Ascites. Ascites is due to combination of liver failure and portal hypertension. It is a soda. This is fluid transsudation. In Gelodhara, there is one side accumulation of fluid in peritoneum, and the fluid cannot go back into the circulation. In Gelodhara, two types of fluid accumulation. Picha Utpatti, that is protein-rich fluid, and Udaka Utpatti, transparent fluid are seen. Stages of Gelodhara, Udara Pururubam, Dosha Uttaram, Ajadodakam, Picha Utpatti, Jala Utpatti. Portal hypertension means elevation of pressure in the portal circulation. The ultrasound, when we do, if you see the portal hypertension and we see the shrinkage of liver, if you see the size of liver, span of the liver, that is reduced, and if you see the splenomegaly, that means already decompensation has taken place. Portal Doppler can be ordered separately along with ultrasound. The flow should be towards the liver. Hematemesis, hemoptysis, hemorrhoids, collateral circulation, esophagus. That is why in all cirrhosis cases, upper GI endoscopy is done to find out esophageal varices, and they do banding ligation to prevent bleeding in cases if it is clinically needed. Pedal edema, sometimes I have diagnosed liver cases with pedal edema alone. Sometimes I have diagnosed cases with epistaxis alone. Sometimes I have diagnosed liver diseases with purpura alone. Sometimes I have diagnosed liver cases with hypogonadism alone. So by experience, this is a decompensated patient. Cirrhosis, Paribhadram Panjangam Kashayam, Drakshadi Kashayam, Bringarada Churnam, Pippali Sharavunga Kalkam, Kumari Swarasam, Shiva Guliga. This is our conventional prescription. Kaudadatrafala, Swarnamakshika Basmam is given. Liver failure, we may not be able to manage. We have to refer it to allopathy. Primary biliary cirrhosis. This is very important because in rheumatoid arthritis and in SLE, this disease is associated. There you will be seeing anti-mitochondrial antibody test positive. So this is what it is seen. Stool may be pale, hepatomegaly, splenomegaly will be seen, xanthoma, xantholasma will be seen, anti-mitochondrial antibody will be positive. To see the bile duct, MRCP is done, magnetic resonance cholangiopancreatography. It is a non-invasive procedure. MRCP can be done to see the ducts very clearly. You see this xantholasma. In biliary cirrhosis, Drakshadi, Mridvigadi, Kumari Surasam, Bringrada Chornam, Sharabunga Vilvadi Lehiam are given. In portal vein thrombosis, Butt-Chiari syndrome, esophageal varices, hematemesis, heart failure, constructive pericarditis, CA liver, pancreas, stomach CA can produce this condition. Alpha fetoprotein will be very, very, very high in this condition. I have treated only 2 cases in last 22 years of my practice. Puduchyadi, Punarnavadi, Brigatyadi, Dasamula Haridahi, Levam, Kshara Prayogam, Agil Toladi, Ksharam, Shivaguliga, Chetanam, Leganam, to remove the blockage, Kalyanagagulam for Virejan, amoebic liver abscess, Trayandyadi, Negrodhyadi, Krimigna Ganam, Haidaryadi Kashayam, Charangeriadi Takram, Kalasaga Takram are very effective. Even otherwise, Kalasaga Takram every day, Takram with Trigodu every day is good for people with fatty liver. Reducing the central adiposity is also very effective. Arogya Vardhini Vadi, which contains Kadagarogini, we don't use it much because it contains Tamrapasma and all, so we don't use that. Portal hypertension, it is not a separate entity. Patya Punarnavadi Kashayam, if it is ascites with portal hypertension, Patya Punarnavadi Kashayam, Narayana Churnam, Dugdha Vadi. Dugdha Vadi is told in Vaishyajaratnavadi in Shofariharam. It contains Vatsanabi and Dattura Bijam. Bhavanam is done with Dattura Swarasam. It contains 10 grams of lingam also. Dugdha Vadi is a very famous preparation used for portal hypertension with ascites. Tiktakam Kashayam, Guduji Trifala Trivrit Prayogam, Punarnavadi Kashayam, Trivrit Kshira Kashayam for Nityameva Virejayed, Padola Churnam, Narayana Churnam, Gudusi juice, Dasamula Paniyam, Mandura Vadagam are used. Mandura Vadagam contains Manduram, Swarnamakshigam, Gomutra Bhavana. We should not forget that. Lot of Loha Kalpanas are told in Pandu. We have got around 10 Loha Kalpanas, but everything has got a specificity and a generality. Vardhamana Pipali is not done in esophageal varices. That's very important. In NASH cirrhosis without esophageal varices, that's why I have written ascites with portal hypertension, ascites not associated with portal hypertension. If ascites is associated with portal hypertension and varices, Punarnavadi, Bragatyadi, Desamura Haridagi, Kanta Senturam. You see, Tiktarsa, Shofaka. If there is no ascites, Dasamula Panchagoladi, Gomutram, Tikshna Virejanam are given. That means to prevent the bleeding, that is a simple thing. Whether you have portal hypertension, esophageal varices, ascites. If there is esophageal varices, you have to prevent bleeding. Punarnavadi, Dasamula Ridiki, Kandasantura. If there is no bleeding risk, Dasamula Panchagoladi, Gomutra Harideki, Tishna Virejanam, Dandi Harideki. This is the protocol you should follow. Avoid Tikshna Virejanam in esophageal varices. Mridu Virejanam is done. Wilson's disease, accumulation of copper in the liver, which produce extrapyramidal features also. In children are affected. We will be checking serum ceruloplasmin and urine copper. Low copper diet, that is low mushrooms, nuts, chocolates, dried fruits, liver and shellfish are avoided. Punarnavadi Nimbatvagadi Kashayam. Tamra Shodhana Vargam, that is, there is a theory which is not proved. If the drugs which are capable of purifying Tamra outside, it should be capable of purifying Tamra inside. So the Manjishta, Laksha, Nagakeshara, Kumkumakeshara, all Rakta Varga Dravyas are made into Kashayam and can be tried. Dasamula Haridagi, Drakshadi Rasayam. Budd-Chiari syndrome, already I talked about that. Hepatoma, hepatocellular cancer. If it is not spreading, I will go for Trayantyadi with Shiva Guliga, Parivaldram Matsyantaka Kashayam with Shiva Guliga, Vasa Swarasam at least 100 ml a day to prevent bleeding and to maintain thrombocytes, to prevent acute thrombocytopenia. Vasa Swarasam, Papaya Swarasam has to be given. Chinchadi Legium, Sharabunga Kalkam can be given. Sharabunga Kalpam Vardhamanam can also be done. Gallstone is a very tricky thing. Many people, obese ladies, come with gallstone. Many are asymptomatic, some are symptomatic. They end up in surgery. Without some Kaya Chikisa people approach like Gulma, and they will be giving Varunadi, Hinduvajadi, Avil Toladi, Basmam, Dandi Haridagi, Gulma Prayogam. Some cases effect will be there, some cases effect will not be there. Some people apply the principle of Ashmari, they will be giving Varunadi, Chandraprabha, Kalyana Raksharam. That's also not effective. Some people apply Sagagada Kamala, but in my practice I go for Trayantyadi. Long time usage of Trayantyadi produces effect. And Murphy sign and all, you know, Trayantyadi, Kulattadi, Saptasaram, Apamar Kaksharam, Trigodu, Kaidarium, Ayachanduram, Mandura Sanduram are very effective. But gallstone, to tell the truth, is a tough area. Many times, if you write a ultrasound, we can prevent cholecystitis infection and postpone the operation, but stone will be there. 2 mm, 3 mm changes we cannot take into credit, because the man who is using the probe, individual variations will come. So we have to be very logistic in those conditions. Amylase, lipase, complete blood count, liver function test, USG abdomen, fasting. Fasting USG abdomen is needed for gallbladder stone, not after eating, it will be contracted. If there is acute cholecystitis, Trayandyadi, Guduchyadi, Shaddaranam, Trigudu will be very effective. In Halimagam, Mahisha Gridam is told. Halimagam treatments are, Halimagam I feel it is hepatic encephalopathy. Splenomegaly, as it is, spleen is stocked with liver. Spleen is enlarged in polycythemia, hereditary spherocytosis, sickle cell anemia, thalassemia, typhoid, viral fevers, malaria, Hodgkin's lymphoma, and in cirrhosis. Cirrhosis it is. In Vada Udaram, usually I consider leukemias as Vada Pandu and treat, hemolytic anemias at Pitta Pandu and treat, nutritional anemias, megaloblastic anemias, Kapha Pandu and treat. That's my way of approach. Vada Udaram actually is not jala, there is waxing and waning. Vada Udara Chikitsa I have applied in right heart failure. It was found to be very effective. Vada Udaram. Pitta Udaram, peritonitis and cirrhosis combined together, you see it in Pitta Udaram. Kapha Udaram can be NASH cirrhosis or biliary cirrhosis, and the stools are pale in color, and you see a lot of collaterals. So what does it indicate? Udaram is an extended version of portal hypertension. As I say, Kshuddra Roga is an extended version of Kushta Roga, except bearing Chidrodaram, remaining all types of Udara Rogas are the grades of portal hypertension of varied etiology. Abdominal collaterals are described in Udara Rogas are portal hypertension of varied etiologies. Siravidam is useful in splenomegaly, that is told. Probably in polycythemia vera, where spleen is enlarged, Siravidam may be effective. In polycythemia vera, it initially serves to reduce the hyperviscosity by bringing the hemocrit into the normal range. This is essential in order to prevent thrombosis. It is very difficult to explain why vein in the right hand for Ekrutodaram, vein in the left hand for Plihodaram is mentioned, because all vein from the hands drain to superior vena cava via axillary vein and then subclavian vein. So the immediate effect of phlebectomy, Siravila, must be on systemic circulation rather than portal circulation. Very important. All the veins from the hand drain to superior vena cava via axillary and then subclavian veins to the immediate. So the immediate effect of Siraveda may be on systemic circulation, not on portal. Portal circulation then may subsequently respond to the changes in the systemic circulation. So lot of iron supplements told in Panda Chikisa, so many iron, so many Mandura, so many Swarnamakshikas, Ayakanta Chanduram, specifically in Kapha Pandu, Ayachanduram, Pitta Pandu, Mandura Vadagam, Kapha Pandu, Vitiligo, Kanta Chanduram, Tridoshagaram, Kamala Recovery, Mahodaram, Ayaviram, Pandu in systemic diseases like RA, Amavadam, etc., Logavasvam, Kapacha Pandu, eye diseases, Sadavari Manduram, Pandu due to Adisthulam, Pratara Avastha, Tapyadi Logam, Pandu due to Yoni Rogas, Shilajitvadi Logam, Pandu due to Kshaya Rogas, Mandura Vadagam, Pandu, Kafa Pandu, and in Urustambam. With that, I conclude today's class on hepatology, and thank you very much for patient listening. I have given an overall picture what is possible in 1 hour time that is stipulated and given to me. So I have covered about the basics, and I have told about my treatment experience, investigations, and the importance of NASH and the big role of Ayurveda in preventing NAFLD to NASH, NASH to fibrosis, fibrosis to cirrhosis. Ayurveda has got a great role to play. And in early stages of non-metastatic hepatocellular carcinoma our medicines are very effective. We usually treat M&D and rheumatoid. This is an area where we are much more stronger and our medicines are much more effective. I have openly told the medicines used in our Vaidyasalai used by my grandfather also. Thank you very much.
Hello,
Dr.
sir.
Vijayanath, please unmute yourself.
Hello. That was a very informative session, that too based on the fundamentals of Ayurveda. We have a few queries, and Dr. Ramya Radhakrishnan, she has raised her hand. So, Dr. Ramya, please ask your query. Dr. Ramya, please ask your query.
Am I audible?
Yeah.
Okay. Namaskaram, sir. Very happy to hear your session again. Sir, my question is regarding cases of. I had been treating a few cases of liver cirrhosis, sir. Avada problem എന്താ കണ്ടിട്ടുള്ളതെന്ന് വെച്ച് കഴിഞ്ഞാൽ I have experience with 2 to 3 cases wherein NASH ആണ്, no history, 2 are females and 1 male. After I've been dealing it with Patola Katurohinyadi Kashayam, and we had prepared Narayana Churnam, and the kind of mild ascites and all patients were responding. They were feeling generally good, and general health was improving, weakness and all was improving. 1.5 years I could run with that, sir. But once the WBC count, total WBC count was coming lower and lower, and in that particular, of course, they were becoming a little more feeling of weakness was there basically. How should we actually understand Kamala, Kumbha Kamala clinically, and how can we differentiate the approach of treatment? And like Patola Katurohinyadi Kashayam or Vasha Guluchadi Kashayam or Nimbatogadi Kashayam, all these things have Kamala in the background. Clinically, how can we exactly understand the application of these Kashayas, sir? And when to move from Kashaya to like Draksha Dilehim or something wherein we see Agni is not that good, but it may support. And also in the clinics, what's your experience with respect to liver cirrhosis, especially NASH cases, sir? Thank you.
Already I have told Ramya the same points. NASH, end stage of NASH, you have thrombocytopenia and leukocytopenia, where medicines like Shavanaprasam, Agastya Rasayanam has to be given. You remember Guduchi Prayogam and Agastya Rasayanam comes under the last paragraph of Kamala Chikitsa in Ashtanga Hridaya along with Yavanavasti. We may not be able to give Yavanavasti in this condition. So coming to the selection of Padola Muladi, Padola Kaduroginyadi, Nimbattogadi, Vasa Guduchiadi, Abhipati Churnam, Narayana Churnam, Ala, Tiktarasa, Ruksha Virejana, you have to assess the Koshta, Agni and the nature of Mala and the nature of Mala Sanchaya in the body, that is Snega Vriddhi of Kapha and Pitta, to select the medicine. One day, if you are starting for Nimbattogadi, if the Samyak Niruga, Samyak Virejana, like Nati Snigdhan Virejaye, Snegavanam is not at all followed, Ruksha Virejanam, directly Ruksha Virejanam is given. But in conditions like Trayandyadi, Girdam is given along with Kashaya. After the Ruksha Avastha, you can see in the body, already these people have dry skin, and along with usually these people will have low sodium level also in the end stage of NASH cirrhosis. Then we have to go for stop these Tiktarasa Ruksha Prayogas, and then they have to go for Madhurarasa. Once ascites is gone, ascites is reduced, circumference of the abdominal is reduced, this Nitya Shodhana, Nitya Virejana has to be stopped, and Madhurarasa Pradhanya Amalagi Legium or Drakshadi Legium or Drakshadi Rasayanam has to be given for longer period along with Brindaradam. Brindaradam and Sharagundam are the 2 drugs which we are not exposed in much parts of Kerala where I have done that. They maintain Bringaradam is a Pandugaradravya. The Bringaradam usage reduces thrombocytopenia and leukocytopenia in these cases. Very few people have lived up to 5 years. 1 or 2 people have entered in transplant. 80 to 85% of the people take our medicine. For Kamala and Pandu Chikisa, 10 drugs are totally essential. One Tiktarasam, Shodhanam, one Madhurarasam, one Nasyam, one Rucha Virejanam, one Rasayana, and few single drugs based on the local places. So NASH, first you have the early stages of NASH, Kafakaram Yakrut Visesha Chikisa like Takra Prayogam, Sarabunga Prayogam, Pippali Prayogam has to be done. Once slowly mild elevation of bilirubin comes and platelets will start coming down less than 1.2, you have to go for Vasa Guduchyadi, Brigatyadi, etc. Then fibroscan shows F4, F3, F4, and if you start seeing mild portal pressure elevation with mild splenomegaly, Ruksha Virejanam followed by Madhurarasa Prayogam is important. If there is no collaterals and esophageal varices, Vardhamana Vipali in low dosage in a short period instead of 19 days, 14 days with Kimsugavatra Kshara to prevent the metabolic acidosis will be effective. This is what I do in my practice and I feel it is very effective.
Okay, thank you, sir. 2 more have raised their hands. Dr. Naresh, please ask your query. Dr. Naresh Kori. Dr. Naresh? Hello? Dr. Naresh?
Hello.
Hello? Please
Hello.
ask your
Hi,
query.
sir. Yes, yes. A lot of Sneha Dravyas has been explained in the Samhitas, and as per the modern science, the total fat contraindication is there in the cases of hepatobiliary diseases, sir. So, what is your opinion, sir, regarding the Sneha Kalpana? And you have not mentioned a single Sneha in this particular PPT, sir.
After all the process are over, giving Tiktaka Gradam or Mahadiktaka Gradam is not bad. When avasthas are demanding, avastham prapya nirdishtam pushtinam vasti karmaja. After the Tiktarasa Prayoga, Churna Prayoga, Virejana Prayoga, Ruksha Virejana, we can end the therapy with Mahadiktaka Grada in a low samana dosage, which is not wrong. Because in Vada Vyadis, treatment can end up in Snegana. When the avastha becomes Vadaja, little bit of Snegana is also good. Pandu Chikisa starts with the Snegana. So Snegana, Pandu, if it is a very specific Pandu spectrum, I would have told about Snegana more. Pittam is Snegam, Tapham is Snegam. So the opposite karma is Ruksha. Fat does not produce fatty liver. It is the carbohydrate that is producing according to modern medicine. They ask you to restrict the fat. Nowadays, new theories are coming. More protein, more fat and less carbohydrate theories are also coming. So there is nothing. If Avastha Agni Balam is there, when Vada Pitta Vritti is there, Kapha Kshayam is there, Mahatiktaka Gradam giving is not at all wrong.
Okay, sir. Thank you very much. Dr.
Thank you.
Vishnu. Dr. Vishnu, please ask your query. Dr. Vishnu.
Yeah, I am audible, sir.
Good evening,
Definitely.
Vishnu.
Yeah. Myself, Dr. Vishnu Chaudhary, sir, from Shillong, Meghalaya.
Meghalaya. Namaste, namaste.
Namaste, sir. Namaste. Sir, my query is how we can treat the asymptomatic hepatitis B positive cases or chronic stages where there is no symptoms. Is there any treatment required or we can leave it like this?
I told you, acute phase respond very well with Padolamunadi, Jimudanasyam and all. Acute phase respond very well. The carrier phase is Budalinga Abhyakta Vyadi, where we have to do Shodhana and Rasayana for long period. Carrier will be carrier. Then what is the effect of our treatment? It will prevent cirrhosis and hepatocellular cancer in those cases if they are on Rasayanas.
Sir, what Rasayana will you prefer, sir?
Drakshadi Rasayana, Bringaraja Kalpam, Ayachanduram, once in 3 months, Virejanam with the Kalyanaga Gulam, Very effective.
Sir,
Avoiding
Tamal
pitta
ki having
vardhana agara vigaras.
the Tamal ki having any role, sir? Tamal ki Phyllanthus neuri.
Phyllanthus neruri, there are 7 subspecies. Only 2 species are found to be reducing the viral load, not the other 5. So that is why you get mixed result with Phyllanthus neruri.
Thank you, sir. Thank you very much, sir.
Okay, thank you, sir. Dr. Manish, please ask your query. Dr. Manish Patil.
Sir,
Unmute yourself. Please unmute yourself. Dr. Manish, please.
yes,
Yeah.
yes. Can you differentiate, sir, the NASH patients from non-alcoholic patient? The one question, and the second one, the Vat Pitta Ka. Hello, you are getting my voice, sir?
No, repeat it once again.
Sir, can we differentiate the patient of NASH with non-alcoholic fatty liver?
Only by history.
Only by history. And the second one, sir, can we categorize the patient in Vataj, Pittaj, Kapaj in NASH patients?
Yeah. Early fatty liver kaphaja, hepatitis stage when bilirubin increases pittaja, when fibrosis comes, that is vadaja.
Sir, all the cirrhosis patients are Vataja?
They end up in vadaja.
Okay. Even alcoholic are Vataja?
Alcoholic end up in vadaja.
Okay. Thank you, sir.
Okay, sir. Thank you. Now, one small query from the part of the moderator. Sir, if we look into the yogas, especially mentioned in Sahasra Yoga, like Manibhadra, Maharasnadi Kashaya, Chavanaprasha and all, we see the word pliha appearing in the Falasruti more number of times compared to Yakrut. So what could be the reason?
That's an amazing question. Prevalence probably, because for a clinician, palpable spleen is a easy diagnosis than a palpable liver. Palpable spleen is a very direct, easy diagnosis. Probably the clinical prevalence seen by the acharyas would have been more splenomegaly, and they would have given importance to that.
Okay, sir. Thank you very much. Now, one Dr. Mansoor has raised his hand. Please come forward. Dr. Mansoor Faruqi, please ask your query.
Good evening, sir. Sir, I'm audible?
Yeah, you are audible.
सर
Please
मैं
go.
मंसूर फारूकी सर मैं पंजाब से बोल रहा हूँ मैं सर मेरे नानी जी को हेपेटाइटिस सी था सर लेकिन वो ठीक हो गया बट जो उनका एब्डोमेन है वो बहुत हार्ड रहता है सर उससे सर उनको हर रोज एलोपैथी मेडिसिन खानी पड़ती है वो रेंटिडिन का रोज कैप्सूल खाते हैं सुबह और पेट उनका बहुत ज्यादा हार्ड रहता है सर उसका कुछ हो सकता है ट्रीटमेंट और कैप्सूल के बिना उनका पेट भी साफ नहीं होता अच्छा
Can you ask in English, sir? Hepatitis C?
yes sir hepatitis C sir
Hepatitis C?
जी sir hepatitis C
Hepatitis C we are seeing once in a while we are seeing. What is the question?
सर हेपेटाइटिस सी सर मेरी नानी जी को था 65 इयर्स ओल्ड है सर वो हेपेटाइटिस सी
Same Koshtagada Kamala Chikitsa only. B and C we do not have any differentiation. Starts with Piktarasa, Madhurarasa, Rasayana. Same thing we have to give. Long time usage of Rasayana.
थैंक यू सर
There is no
सर उनका
difference
पोस्ट
between
बहुत
B and
कठोर
C in
रहता है सर वो
Ayurveda.
कठोर ठीक हो जाएगा सर बहुत कठोर रहता है उनका पोस्ट
Dr. Mansoor, please ask your question once more.
सर उनका एब्डोमेन बहुत हार्ड रहता है सर
Mobile?
Sir, he's telling that the
He says that his
abdomen is very hard. Abdomen is very hard.
यस सर
Can you please clarify more, Dr. Mansoor?
यस सर उनका एब्डोमेन बहुत हार्ड रहता है सर
Sir, slowly you ask your question.
Sir, Sir, he's asking that the patient's abdomen is very hard.
Karibudam.
Uh,
That will go away by our Sofagna Chikissa. Once you do continuously, I have shown a case, abdominal size was 51, it became 48. Nitya Virejana Chikissa, Malasanjaya Chikissa will reduce that. It is accumulation of Malasanjaya. Once the Malasanjaya comes down, it will become soft.
Okay, sir. Okay, sir. Thank you. Dr. Ravindra Daswant. Please ask your query. Dr. Ravindra Daswant. Hello, Dr. Ravindra. Hello, Dr. Ravindra Daswant.
Hello, sir. Good evening, sir. Dr. Ravindra here.
Go on, go on.
Yeah. Sir, recently in modern science, they are diagnosing some hepatitis as autoimmune hepatitis.
Yeah. Autoimmune hepatitis, already I told, even when we give some drugs like Guduji in rheumatoid cases, some rheumatoid patients develop hepatitis. That is autoimmune hepatitis. We have to, in modern medicine, they give steroids, immunosuppressants to stop that problem. They give some other drug also, I have forgotten. The immunosuppressants are given. So that is why in rheumatoid patients, we have to check anti-phospholipid antibody, ANA, anti-mitochondrial antibody, anti-LKM antibody. So this autoimmune hepatitis, when it comes to Ayurveda in a rheumatoid, we have to go for medicines like Punarnavadi Kashayam, Shivaguliga, Trivruta Churnam, Virejanam, and Gokshura Paniyam, like that. Sometimes bilirubin will be very drastically increasing. 2, 4, 6, 19, 20 and all. At that time, better to refer to allopathic doctor to put them on methylprednisolone to control the cases. Otherwise, serious complications will come. When the cases are stabilized after steroids and azithromycin, a drug is called azithromycin, when they are stabilized with immunosuppressives, low dose of medicines we can restart. When it is very aggressively increasing, crossing 18, better to go to modern medicine. We should not handle that, especially autoimmune hepatitis coming in a rheumatoid case.
Okay, sir. Okay.
Thank you, sir. One final question by Dr. Santosh Chavan. Please, Dr. Santosh, unmute yourself and ask your query.
Yes, am I audible?
Yeah, yeah, you are. Go on, go on.
Okay. So my question is regarding hepatitis B. Am I audible, sir? Hepatitis B. Hepatitis B. So there are certain cases of hepatitis B where there is no increase in the liver function test. Even the surface antigen is positive, that is HSV-AG, Australian antigen positive, but no viral load. So what will we call this case as? Whether the hepatitis B is curable or not? Hello.
Already 2-3 times I told Gudalinga Abhyakta Vyadi, Abhyakta Lakshanam Tesham, Sodana and Rasayana has to be done. Many people live with that without any problem lifelong. Few people may develop cirrhosis and hepatocellular carcinoma. If they do Masanama, Virejanam and Rasayanas, that will be prevented.
Okay, sir. Thank you. Last person who has raised his hands, Rakesh Salve. Please unmute yourself and ask your query, Dr. Rakesh. Vaidya Rakesh.
Hello, good evening, sir.
Good evening.
Thank you, sir, for a wonderful lecture. My doubt was, sir, how can we manage thrombocytopenia, which is seen in chronic liver diseases?
Vasa Prayogam. Vasa
okay, sir.
juice in high quantity and taking medicines in Raktavitta. Nishundi Shadangam. Shadangam without Shundi, instead of Shudingi, Shundi add Amruda and make Amruda Shadangam, Draksha the Fanta Kalpana, Vasa Swarasam. Previous day Vasa is collected, kept in water, next day put it in mixie, taking at least 200 ml per day. with honey you should give. Once the liver gets corrected, thrombocytopenia will automatically corrected. So parallelly, Yakrit Vishesha Aushadas has to be given. Thrombocytopenia, leukocytopenia are the expressions of malfunctioning of liver. They are not separate entities. This
Okay,
is
sir.
applicable to growth thrombin time also.
Okay, sir. Thank you. Dr. Arjun, hope there are no questions from the YouTube channel.
Yes, sir.
So, okay. So, shall we conclude?
Yeah.
Okay, sir. So, that was a really enlightening session. There can be many adjectives that can be used to describe this wonderful session, but I would rather select the word convincing, because the way you mentioned about the each diseases and their choice of
I think there is
you can
some
subscribe to the AMI.
audibility issues with. Okay.
Hello. Those who have missed this session, you can subscribe to the AMI YouTube channel. And I am handing over the mic to Dr. Rajesh to deliver the vote of thanks.
Yeah, good evening to all. As always, Dr. Mahadevan sir finished his session storming our thoughts. Actually, we all were talking about some Umpun a cyclone last week. That was a destructive one. But here in the APTA webinar follow, Mahadevan sir stormed constructively. He enriched our thoughts. He sharpened our tools. So a great thanks to Dr. Mahadevan sir from all on behalf of AMI, Ayurveda Medical Association of India. Thank you, sir. Thank you.
Thanks.
Yeah, I wish to thank all AMI members and all the participants around the globe. Sir, we have the limited crossed our limit of the Zoom, and so many participants are viewing through the YouTube, and we will be uploading the video to the YouTube channel for many more years. Your great words will serve to Ayurveda fraternity with confidence to treat all hepatobiliary diseases. Thank you, sir. Thank you. Thank you to all the participants. I wish to thank all the AMI members and Ayurveda Medical Association of India President Dr. Raju Thomas, our General Secretary Dr. Sadhu Nagar, our Treasurer Dr. Mansoor Ali
diseases. Please.
And our APTA webinar team, Dr. Vijayanath, who have moderated today, Dr. Arjun, Dr. Jigish, Dr. Ajmal, Dr. Jose. Thank you all. And our next class is on 30th, this Saturday. Dr. Jose T. Paikada. This is for our Kerala viewers. He will be taking the class in Malayalam. And the subject is clinical experiences in managing rare diseases. And May 31st, we have a session for our international viewers. That is Dr. J.L.N. Shastri, our great Dravya expert, who is the CEO of National Medicinal Plan Board. He is taking class on importance of cultivation in Ayurveda curriculum. You can please subscribe AMA this YouTube channel for all the updates. Thank you. Good night.
Dr. Ajmal, we can end the session. Thank you.